What is meningitis? Causes, symptoms, and treatment. Interesting about science and medicine, prepared by editors of a channel All Scientifical. What is meningitis? Meningitis is an inflammation of the membranes that cover the brain and spinal cord. Some type of meningitis, especially infectious one, require special attention to prevent the infection from reaching the brain. What are the most common type of meningitis? Many diseases can be accompanied by inflammation of the membranes, but infectious meningitis is most common with other type of meningitis. What type of infectious meningitis are there? There are two types of infectious meningitis depending on the appearance of a cerebrospinal fluid analyzed after a spinal sample is taken. Purulent meningitis, in which the cerebrospinal fluid is cloudy. Serous meningitis, in which the cerebrospinal fluid is clear. As a rule, serous type of meningitis are viral in origin. What is a cerebrospinal fluid? Cerebral fluid is a clear fluid substance that surrounds the central nervous systems and fills the cavity of the brain. What does the meninge consist of? The meninges are composed of three layers of a central nervous system, the dura mater, in thick membrane surrounding the brain and spinal cord. The pia mater is a membrane that comes into contact with the nervous tissue. The arachnoid mater is located between the dura and pia mater. Common signs of meningitis. The disease progresses very rapidly with the following symptoms: Meningeal syndrome, fever, headache, which worsens with exposure to light and noise. Spinal pain, back muscle becomes stiff, forcing the patient to sleep on one side and bend knee to relieve muscle tension. Difficulty in placing the chin on the chest, accompanied by severe pain. If left untreated, meningitis can worsen, leading to complications such as seizures, attention deficits, coma. Depending on the type of meningitis, the patient may also experience the other symptoms. During infectious meningitis, bacteria can spread through the bloodstream through to the body, causing sepsis and also invade internal organs. Symptoms of meningococcal meningitis. Meningococcal meningitis is characterized by a hemorrhagic rash with small red dots, petechial purpura, appearing on the skin. Signs of tuberculosis meningitis. Tuberculosis meningitis is a form of the disease with clear cerebrospinal fluid caused by Cox's bacillus, can lead to serious complications affecting the oculomotor nerves. Because of this, the patient may experience visual impairment and even coma. Symptoms of meningoencephalitis. If meningitis is caused by herpes virus, the disease can progress to meningoencephalitis, the symptoms of which include paralysis, seizures, coma. Cause of purulent meningitis. The cause of such disease are Pneumococcus, Meningococcus, Haemophilus, influenza. Haemophilus influenza meningitis is especially dangerous for children under 3 years of age. Cause of pneumococcal meningitis. Pneumococcal meningitis occurs as a result of an exacerbation of an ear, sinus, or respiratory infection. The progression of this disease is often acute. Can meningitis cause an epidemic? Meningococcal meningitis, cerebrospinal meningitis can cause epidemics in children's groups, kindergartens, schools. Sometimes the pathogens is localized in the mucous membrane of the throat. Will the disease remain latent? A healthy carrier can infect others by coughing. Cause of serous meningitis. In most cases, first form of a disease are caused by fungus, Cox's bacillus, the causative agent of tuberculosis, Listeria monocytogenes, the causative agent of listeriosis, rickettsia. This form of a disease can also be caused by a virus, viral meningitis. There are many viruses that can cause meningitis, but unfortunately many of them are benign. Treatment of meningitis, purulent type of meningitis. In such diseases are suspected, immediate medical intervention is required. A lumbar puncture is used to confirm a diagnosis and determine the appropriate treatment. Typically, antibiotics are administered intramuscular and the duration of treatment depend on the type of and severity of a disease. Treatment of serous meningitis. Treatment depends on the cause of a disease. Anti-tuberculosis drug for tuberculosis, antibiotics for listeriosis, for viral form, painkillers, antipyretics are prescribed to reduce fever and relieve pain. If the cause of meningitis is the herpes virus, antiviral drugs are ineffective. What is a lumbar puncture? A lumbar puncture involves inserting a special needle into the lower spine to remove a sample of cerebrospinal fluid. Analysis of a cerebrospinal fluid can determine the presence of meningitis or bleeding with a meninges. The punctures allow for the administration of intramuscular medication, chemotherapy, antibiotics for contrast agents. This procedure is performed only in a hospital and typically without local anesthesia. There are no particular risks associated with this lumbar puncture, but the patient should remain horizontal for 24 hours afterwards to avoid headaches. Prevention of meningitis. Depending on the pathogen, prevention varies for each type of meningitis, but in the case of meningococcal meningitis, antibiotics are recommended after contact between a healthy person and an infected person. Thank you for your attention. This material is based on material from the channel All Scientific. Caution: before using any treatment method and medication, is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.